Hi, I'm Dr. David Magnano from Vitality Regenerative Medicine. I want to thank you for joining me. I've been getting a lot of questions about whether it's better to have the cells, the stem cells, used from your own body, like through a hip aspiration or your own adipose or fat tissues, or is it better to use these donated tissues from women that have had C-sections and have umbilical cords. So I want to tell you about the procedure just so you have a full understanding of which way this may help in your whole decision-making process. So when you have a bone aspiration, they have to actually go into the bone marrow. Of course, it's a painful procedure. Nobody's really happy about that. It's very uncomfortable. You do run the risk of infection. But having said all that, when you get the cells, are they quality and usable cells? What we know is that usually we're doing this for a degenerative condition like a degenerative knee or somebody that has spinal stenosis or some back condition or something along those lines. So what we know is that's generally an older patient. Now, an older patient has larger stem cells. They move much slower. There's less of the growth factors and the cytokines, and they've been damaged by the environment. Sunlight is very damaging to stem cells. Of course, the toxins, medications, pesticides, just the life well lived, that tends to put stress on the stem cells, and they're not as active as the new younger stem cells are. The new younger stem cells are much smaller. They can move to the area of inflammation or damage much quicker. We know that a brand new stem cell is going to reproduce every 24 to 28 hours. That means it duplicates every 24 to 28 hours. And a new stem cell has about 90 generations of this occurring. So this is happening very rapidly, and this is how we get the growth of new cartilage and new tissue. This is very important. On somebody the age, say my age, 58, 60, 65 years old, a lot of our patients are in that age range, it'll take 3 or 4 months for one of those stem cells to reproduce. And they're limited to maybe 2 or 3 generations of that duplication. So we have much less healing with older cells. Not even said that you have to go through the process of extracting the cells. It's generally a visit to extract the cells, and then it's another visit to inject them. When you come into our office, we're using these newer, younger umbilical cord stem cells. You're in the office. It's a one procedure, one injection. It's not multiple services. It's not multiple visits, things of that nature. But the quality of these umbilical stem cells are much higher quality. They duplicate much faster. They have many, many generations of duplication. They're slower. They're smaller and faster moving to the site and origin of injury. And yes, they haven't been damaged by the environment, mainly sun and toxins and things of that nature. So when you're comparing the two, there's actually no comparison. It's less expensive to use the umbilical cord because you're reducing one of the procedures. There's less pain, there's less chance of infection, and the quality of the cells, there's not even a comparison. If you can get these younger, faster quality cells working on your degenerative condition rather than the older ones that quite honestly have not been able to handle the condition, then you're far better off using the younger cells. Once again, I'm Dr. David Magnano, and I thank you for joining me.